The following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm Shay Paul, and I am being joined by my friend Dr. Jared Chapman, Master Injectionist and Medical Director of Living Well. How are you, Dr. Chapman?
I am absolutely wonderful today.
Well, it's great seeing you. I do look forward to the day that we can see each other in person, but for now, this is the next best thing.
That's right. We're still able to talk and be able to share the good things about aesthetic medicine.
And speaking of, we have a special treat today. You actually have a patient there with you today, and you are going to demonstrate how to inject Botox, correct?
That's correct. I'm going to demonstrate how easy a Botox treatment is.
Okay.
We're treating one of the most common problem areas that patients come in and ask about, which is the lateral canthal lines or the crow's feet. So with 3 to 4 simple injections in this area, we can pretty much erase these lines from the face, allowing the patient to look more youthful, usually aiding in about maybe 5 to 6 years off the face just by doing some simple Botox in this area and the forehead. It's a very simple procedure, so I'm going to go ahead and clean the patient right now.
Okay.
She has a little bit of numbing medicine on just to make this a little more comfortable for her.
Okay. So you're just using like a cotton swab with alcohol?
Yes,
here?
cotton saturated with alcohol, yes.
Okay.
And then this is our Botox, and it's just one syringe, very small insulin syringe we use to do our injections.
Okay.
And then we just actually position the patient this way, and we just go laterally here, and we inject right into this area, small little droplets of the solution that contains the Botox, which is a purified protein that actually works at the neuroreceptor to allow to stop the releases of acetylcholine across the channel. And acetylcholine is what helps power the muscle to move. So basically, that is what it tells. That's one side, just a simple treatment.
So in essence, Botox really just temporarily paralyzes the muscle that is causing the wrinkle. Is that correct?
So we use the word freeze or relax.
That's better than paralyze. Yeah, you're right.
That's much better than paralyze, correct. We don't want to imply that we're not going to allow the patient to ever move again. But that's what I was going to say. You know, the science behind it basically is we shut down the release of that acetylcholine, so we stop the movement of that across the neuroreceptor channel to the muscle. Once that has frozen, then the body takes about 3 to 4 months to recreate those receptors in the neuroreceptor channels, in the nerve endings that connect to the muscle. And so basically that's why Botox lasts for 3 to 4 months, because it takes the body that long to produce new receptors to overcome the ones that were blocked by the Botox. And that's how it works. Botox is used for many, many things besides aesthetic procedures. We use it to treat migraine headaches, which we extend the treatment from the brow and the forehead around to the temporalis and back into the occipital region and down the trapezius muscles. That really helps with migraine headaches. The other uses are for bladder spasms. It's used for laryngeal spasms in the throat. A lot of times, even GI doctors can use it in the stomach area to help with certain conditions. So Botox has taken on many more uses and indications from the FDA than just aesthetics. But here at Living Well, we mainly use it for the relief of lateral canthal lines, the glabellar lines, which we call the 11s, and the upper forehead lines. We also use it to treat migraines as well here. So
very